Steroids are powerful, highly active compounds. In a clinical setting, they suppress lethal inflammation and open airways. In a gym, they synthesize massive amounts of muscle tissue. But that raw power exacts a heavy toll on the human body. The physical risks of prolonged exposure range from chronic illness to permanent organ damage. You can manage these risks and protect your long-term health, but only if you map out exactly what you're dealing with. To do that, grab a pen and a piece of paper. We are going to build a personalized steroid safety and monitoring checklist right now, step by step. Getting these rules down on paper today is the best defense against irreversible bodily damage tomorrow. Step 1. At the top of your page, write down the exact name of the medication you are taking. This comparison chart breaks down why that name matters. On the left, in blue, we have corticosteroids, drugs like prednisone and dexamethasone. Doctors prescribe these specifically to calm down the immune system, treating issues like severe allergies, asthma, and chronic inflammation. As the blue column expands, you can see the secondary effects of taking corticosteroids over months or years. The charts here show bone density dropping, which indicates osteoporosis, and blood sugar lines spiking toward diabetic levels. You might also experience weight gain and facial swelling, commonly referred to as moon face. Now, watch the right side of the chart slide in. These orange entries represent anabolic steroids, compounds like testosterone and nandrolone. These serve a completely different purpose. They are primarily used and heavily abused to increase athletic performance and build muscle. Look at this model of the human heart. Anabolic steroids force the cardiovascular system to work under extreme stress. Prolonged use rapidly accelerates the risk of heart attacks and strokes, while simultaneously causing severe toxicity in the liver and kidneys. This diagram highlights the zones where anabolic steroids cause permanent, irreversible physical changes. In men, this includes profound hair loss and breast enlargement, known as gynecomastia. For women, the alterations include a permanently deepened voice and irreversible structural changes to the body. You must know exactly which class of drug you are using. Managing corticosteroid blood sugar spikes requires a completely different medical protocol than treating anabolic liver failure. Let's move to step 2. On your page, write down dosage and interaction rules. We need to establish your daily operating boundaries. If you hold a legal prescription, the golden rule is to use the absolute lowest effective dose. Follow your doctor's exact instructions, and never increase your intake based on how you feel on a given day. You also need to audit what else you are putting into your body. This graphic outlines the dangerous combinations you must avoid. Keep steroids far away from heavy gym supplements, fat burners, growth hormone, recreational drugs, and alcohol. Mixing these specific substances forces your internal organs to process a combined toxic load, accelerating the physical wear on your heart, liver, and kidneys. That brings us to step 3. Add clinical monitoring to your checklist. You need a formal routine to track what is happening inside your body. Start by purchasing a blood pressure cuff and a basic glucose monitor for your home. Because corticosteroids frequently cause silent, unnoticeable spikes in blood pressure and blood sugar, you need to measure these metrics yourself every single day. Next, schedule regular, mandatory lab visits with your physician. Only comprehensive blood work can reveal whether your internal organs are straining or if your immune system is becoming dangerously compromised. Safety requires active, scheduled discipline. You track the numbers daily so you can catch a slow systemic failure well before it becomes a hospital visit. Step 4 is defining your absolute boundaries. Write down emergency triggers on your list. Look at this hazard slate. These are your Tier 1 physical emergencies. If you experience chest pain, shortness of breath, a massive spike in blood pressure, or a sudden fainting spell, your system is failing. The second tier involves visible systemic warnings. Watch for any yellowing of your eyes or skin, which indicates jaundice and liver distress, or severe swelling pooling in your lower legs. There are psychological triggers too. Steroids alter brain chemistry. Severe depression, crippling anxiety, or sudden suicidal thoughts require immediate professional intervention. None of these are normal side effects. You do not try to tough them out. If any of these triggers occur, you drop everything and call 911 or go to an emergency room. Finally, we reach step 5. add tapering protocol to the bottom of your checklist. This visual represents a gland in your body shutting down. When you take external steroids for a long time, your body recognizes the excess chemicals and entirely stops producing its own natural supply. This biological consequence is called hormone suppression. Because of this suppression, stopping your medications suddenly, quitting cold turkey, is incredibly dangerous. Your natural production is asleep, leaving your body utterly unequipped to function without the external drugs. To recover safely, look at this calendar diagram. You must follow a gradual, doctor-monitored reduction in your dosage. Slowly stepping down the milligrams over weeks or months buys your internal glands the necessary time to wake back up and resume natural hormone production. Exiting a steroid cycle requires exactly as much strategic planning as starting one. Put your pen down and look over the document you just built. You now have a complete safety and monitoring plan. You have identified your specific medication type, isolated the chemical combinations you must avoid, and listed the vital daily metrics you need to track. All changes to your dose or timing must be approved by your physician. They are the only ones who can safely navigate the biological risks of adjusting these drugs. Keep this checklist right next to your pill bottle. Using it daily moves you out of the passive patient role, giving you the power to actively protect your long-term health.